So, yeah, we are here with Eric Borgstein. He's a professor of surgery at the University of Medicine College at Malawi, but also consultant pediatric surgeon at the Queen Elizabeth Central Hospital in Blantyre. So, how are you, Eric?
Good. We're all keeping our heads down here.
Brilliant. Well, thank you for your time.
Increased numbers of patients, but facing lockdown in a day or two.
Good. Yeah, we have read about the new announcement of the lockdown that starts this midnight.
Midnight on Saturday, tomorrow.
Saturday, right? Yeah. So far, Eric, has the current crisis affected surgery in your hospital?
Yeah, it has, because there's been quite a long build-up. It's taken time. There's been a long build-up. There haven't been very many cases, but of course, there's so much information now on the social media and on the internet and everywhere that, there's much more awareness than you would expect. And so there's been a lot of fear, and there's been a lot of worry about what could happen, what might happen, and a lot of worst-case scenarios. And so, yes, it has impacted surgery, because we've had to look at it professionally as a kind of worst case scenario, and indeed the hospital may, get inundated with lots of patients. And so we've been trying, very hard over the last few weeks to reduce the number of patients in hospital. So we've reduced elective surgery gradually, working through the patient cases still on the ward, and then trying to reduce the outpatient clinics, because the general surgical outpatients at the hospital will often be, 80 to 100 patients. And so, those kind of large gatherings have been banned in the country a while ago. And so we've been trying to implement that, first of all. So reduce numbers, reduce the visitors, reduce the number of guardians, reduce basically the numbers of people, clustered together in the hospital. So that's meant for surgery that we've been clearing the backlog of cases who've been waiting and who need to get home, and that we've been, kind of turning away elective cases who can wait. That means patients with cancers and so on. Those are semi-emergency. So we'd be doing those, but cases with, simple things that really don't need urgent treatment, we've been saying, well, look, go home or stay at home and come back in the future. So we've cut back on the number of cases. We've tried to cut back on the number of people in the hospital, and that's been the main sort of impact so far. But now that we're facing proper lockdown, that will go to the next level, go to the next step.
Right. Okay. Well, thank you, because you also answered my next question, which was the safety measure implemented to protect patients and in order to this new situation.
Well, so that's been a very big issue, because the staff on the whole have felt unprotected. The provision of, of PPE, of protective equipment, has been minimal. And you've got to remember, we're a health service which at the best of times struggles to cope with, with the requirements. If you look at the work that SURG-Africa has been doing in the district hospitals, there is a massive shortage of materials at the best of times. Surgical drapes, surgical gloves, anything is in short supply, because it's not top of the food chain in the districts, basically, surgery. So there's always shortages, and you can imagine that now with implementing, proper protection, that's a huge burden on the resources. So, and that has led, that together with the fear that is spread by social media and the information that everybody has led to quite some problems now in the functioning of the hospital, with people being reluctant to face possible patients because the protective equipment is inadequate. And so we've been trying our best to find ways and means of supplementing the available things. But of course, with the closure of the borders and the decrease in the amount of commerce that goes on, things are even no longer that easily available, or if they are available, the prices have gone up remarkably. So that's been a major challenge, to see how we can protect the patients, the other patients, and the staff, and particularly the staff are worried.
Mm. And also, besides your different hats there in the university, at the hospital, you also work with SURG-Africa and in Malawi. And that, I was wondering, now with the 21-day lockdown coming, how that is gonna affect the work that SURG-Africa is doing in the country, you reckon?
So it'll impact, first of all, it'll impact the outreach program, which is the kind of core of the SURG-Africa project, is to mentor surgery, anesthesia, obstetrics in the district hospitals. And with the lockdown, that won't be possible. So we've already had to phase out that for the moment. Mm-hmm. We're not able to send our teams out to the district hospitals to do their work. But that has, of course, that has implications in two ways. In one way, it means less support in the district. On the other hand, it means that more patients will be coming to the central hospital. So we've had to look at how we can try to cope with increasing emergency patients being referred to the central hospital. And that's something which hasn't really started to happen yet, but it will. And so the crisis with provision of PPE becomes more acute as that happens. Fortunately, one of the very effective outcomes of the SURG-Africa project has been the managed clinical network, and the active WhatsApp group that deals with problems in the hospitals and referral patients is still working very well, and that's a great resource that allows us to, give advice in the districts, maybe send someone there if they have a case that needs doing, but rather than sending patients in, and certainly discussing referrals, giving appropriate advice, hopefully, empowering clinicians in the districts to do cases they might otherwise not have done, to say, look, sending them to a lockdown central hospital, which is at risk of getting, quite a large number of coronavirus patients, is not the best idea either. So the virtual part of the program is still working and is still very useful and very important. And then, of course, the research side of things goes on, because a lot of that can be done remotely. The researchers are still working. Even the remote group in Ireland continue to put out papers on the findings. The data is still being collected. We have ongoing data collection activities in the district hospitals, which, hopefully we'll be able to continue.
Fantastic. Well, thank you very much. Good luck with everything over there with the new lockdown. I hope, it doesn't affect too much to your...
It will, but we'll have to see how things go. Yeah. Nice to meet you.
Yeah. Thank you very much for your time again, Eric, and we'll be in touch.
Yeah. Take care.
All right. You take care.
Cheerio. Bye.